segment.
Thanks so much, Rob. Okay. Clearly the sound of the community wanting to come together. It's very, very exciting. Now I am going to introduce our next two speakers, and we are so privileged to have Admiral Rachel Levine and Dr. Judy Steinberg. And let me give you their bios, and then they're going to have a fireside chat right here. Dr. Admiral Levine serves as the 17th Assistant Secretary of Health for the U.S. Health and Human Services and head of the U.S. Public Health Service Commission Corps. She's working to help our nation recover from COVID and build a stronger foundation for a healthier future. And seeking to make sure that every American can have the best and healthiest outcomes. She has a storied career. She's a physician first, a primary care physician in academic medicine, and she's focused on the intersection between mental and physical health, treating children, adolescents, and young adults. And as Mark Del Monte said, and she's a pediatrician. So, Dr. Steinberg is Senior Advisor to the Assistant Secretary of Health and Chief Medical Officer in the Department of Health and Human Services. And you please start to come up. She's the Office of Infectious Disease and HIV/AIDS Policy, and as the CMO, she serves as a senior subject matter expert, providing medical and scientific expert advice and counsel across the broad infectious disease portfolios of the office. She also has held leadership positions with the state of Massachusetts and BU School of Medicine, and she has practiced primary care and infectious disease medicine at community health centers and safety net hospitals for nearly 30 years. So we are going to hear from these wonderful speakers about the HHS work to strengthen primary care and their pending report, the Action Plan for Primary Health Care. Please join me in welcoming
Thank you.
Admiral Levine and Dr. Steinberg.
So good afternoon, everyone, and thank you, Anne, for your kind introduction, and thank you, Admiral Levine, for having this fireside chat with the Primary Care Collaborative. Also, I don't know if you caught this from the introduction, but I have the honor and privilege of working for Admiral Levine. I was honored when she asked me to lead the HHS initiative and to join her amazing team. And in a similar way, I'm just so honored to sit beside her and share the HHS initiative to strengthen primary health care with you all. So thank you. So let's get started by understanding a little bit more about Admiral Levine. You all heard that she's a primary care physician, a pediatrician, an adolescent medicine specialist, and you're also a senior public health official. So what have you learned from your experiences in these two types of roles about what's needed to strengthen primary health care in our nation?
Thanks, Judy, for that question, and thank you all. It's really a pleasure to be here. So as you said, I've been a primary care pediatrician and academic medicine pediatrician, primary care adolescent medicine, academic medicine, adolescent medicine. So seeing things from many different perspectives, both in New York at Mount Sinai Hospital and then at the Penn State Hershey Medical Center. And you know, I think that primary care is absolutely critical to healthcare in our nation and really to the health of our nation. I think some of the observations I would have is the importance of the team approach, the importance of a multidisciplinary team in primary care. So that includes, of course, our medical assistants, our nurses, which are critical. I'm the biggest fan ever of nurse practitioners and physician's assistants, which I think is really, really important, and that collaboration in the healthcare team. But there are new members to that team, including psychologists, maybe psychiatrists, and many others that I think form that team that people need in primary care, whether that is in urban areas, suburban areas, or in rural areas. In addition, I've seen things from the specialty background and getting referrals from primary care physicians and know how important that collaboration is. So in adolescent medicine at Penn State, as time went on, I saw patients with eating disorders, anorexia nervosa, bulimia nervosa, binge eating disorder, and would have many referrals from primary care physicians. So that collaboration is important too. From my public health perspective, I also know how important primary care is, really to the health of the primary care system at the local level, the state level, and certainly across our nation. And so that's what we're trying to build. That, with the primary care initiative, is to build that framework of the primary care network that is so important with all of those different pieces across our country.
Thank you. So with that, it makes perfect sense that you championed the HHS initiative to strengthen primary health care at its launch with its launch last year. So tell us about the rationale for that, for HHS to launch this initiative.
Well, I think that is, as you said, critically important for the Department of Health and Human Services to launch and then nurture that initiative. Because, of course, improving primary health care improves access to health care. So one of the critical things that we're supporting is access. It improves the quality of healthcare, so quality is important. It improves healthcare outcomes, and really, under Secretary Becerra, one of the critical issues for HHS is improving health equity. And so you improve access, you improve outcomes, and you improve health equity by supporting the primary care initiative.
Right. So with that, tell us a little bit more about the HHS initiative to strengthen primary health care. What are its aims? What are we reaching for? Well,
as I was alluding to, what we want to do is provide that foundation for primary health care across our nation. And again, we need to work at the local level, we need to work at the state level, in addition to the federal level, and we need to improve primary health care in urban areas, suburban areas, and in rural areas, which I've visited all across the country. I think access is critical, as I mentioned. Health equity is critical, as I mentioned. And so we're trying to work, as a facilitator, as a catalyst. We are the catalyst, but we can't do this at HHS alone. We need to work across HHS and all of our divisions at HHS. We need to work with other federal agencies, state and local health departments, and then we need to work with you, our primary care providers, in terms of getting this done. And so our goal is to be that facilitator. The Secretary has called OASH, the Office of the Assistant Secretary for Health, as the connective tissue of the department and about these issues. So when I heard that, I had to think about that. Gee, a connective tissue. I was hoping the beating heart, but all right, we're the connective tissue. So we're the connective tissue, but I understand that because we're the collaborators across the department, across the administration, and really with you to get this done.
Okay. So it's been a year since the launch of the HHS initiative to strengthen primary health care. What have we accomplished over this past year?
Well, again, we're the catalyst, we're the connective tissue, and so we are looking to stimulate this initiative and to lead this initiative across HHS. And actually, Judy, that's your job. So, so we appreciate you're taking this on. I want to highlight the collaboration that we have across the department. So we are working really closely with all of the other operating and staff divisions. I want to they're really all involved, but I want to highlight our work with HRSA. HRSA is fundamental to this job. It's really, its mission is in terms of strengthening healthcare, so they are absolutely key players for us to collaborate with. We're not looking for a coup in terms of primary care. What we're looking is to foster that collaboration. So HRSA, CMS, obviously, they're the payers. They have a critical role at that table. We're also working with CDC in terms of behavioral health, which is so important. SAMHSA, Indian Health Service. I had the opportunity to actually visit one of the Indian Health Service sites in Tucson, Arizona, and to visit with them. Our Commission Corps officers are very involved, and ARC and many others to strengthen primary health care. It is really this multi-division effort, multi-agency effort that will help us be successful. We want to be intentional about our efforts. We want intentionality. And then we want to make sure that we have action. The plan itself is not sufficient. The plan is the means to action. The Secretary is saying that all the time. What are going to be your actions and outcomes? And so we have met across the department, we've met across the administration, and we've met with hundreds of stakeholders. We've had, because you ran them, 100 stakeholder meetings with patients, with providers, with you all to get this done. So it is a public-private partnership and a collaboration.
Yeah. So thank you, and thank you for the attribution. The HHS initiative to strengthen primary health care has intentionally used the term primary health care. And the action plan is focused on that. So tell us about the choice of this term for the initiative and the initial action plan.
Well, we're trying to take a systems approach to this, and the first order of that is primary health care and wellness. I think that it really involves people at the individual level, the family level, but also in the population level. I mean, one thing the COVID-19 pandemic has shown us is that we are really all truly interconnected, that the decisions that each person makes impacts their family, impacts their community, it impacts their state, and it literally impacts the nation and the world. I think that we want to include the primary care physicians, physician extenders, other key components, nurses, etc. We want that integrated clinical services. For example, the importance of integrating behavioral health in primary care is something that I've been working on for decades, actually, in my role in pediatrics and adolescent medicine. Behavioral health is mental health issues are so important now, and so we want to integrate behavioral health. But then also we want to integrate oral health, pharmacy issues. One of the things we're working on is environmental health issues and the impact of the environment and the impact of climate change. So those are important issues. Clearly, sexual and reproductive health issues, maternal health issues, really all of the different social determinants of health. So that's what all we're trying to do is to integrate all of that. That's your job again, in a coordinated fashion to be able to do that. And we have to do that with an eye on physician and wellness across the whole primary care team. That's actually our great Surgeon General's emphasis. And he had a report a number of months ago on wellness issues among physicians, nurses, really everyone in the healthcare team, and particularly about primary care physicians. So we have to include that wellness perspective as well.
Right. Okay. So, So given that primary healthcare approach, that systems approach to that first order of health and wellness for the people of our nation, what are we aiming for in the HHS initiative? Whenever you have an initiative and develop an action plan, you have to know what the goal state is. So what is our goal state?
Well, I think we're looking, our vision and our mission is whole person-centered care. Family-centered care, I think, is critically important. I think that health equity and equitable access to health care is important, really, across our nation. I think that we want to have primary health care that supports health, that supports well-being, both for the patients and for the providers. I think that we want to promote recovery as we work through the COVID-19 pandemic. Not done yet, unfortunately, but as we work through it, but we've made so much progress. I think that we're looking on building resilience into the healthcare system and resilience for our nation. I think we want to be community-oriented. I think we want to look at the whole person and the whole family, so we need to be longitudinal in our approach, and that, of course, includes pediatrics, but also adolescents, young adults. We were talking about just earlier today that so many young adults have not been accessing primary care. Of course, older adults, and now I'm officially a senior. I'm 65 years old, so we have to include seniors as well. And I think that it's important that that process be integrated and coordinated.
Thank you. Okay. So we've been working on developing an initial action plan for HHS, and it is an initial plan. We recognize that one plan isn't going to do it all, but it will set us on a path. So what can you tell us at this point about the initial HHS action plan?
Well, the HHS action plan for primary health care is proceeding really, really well. And I want to thank you for the fantastic work that you have been doing, coordinating and leading that plan. But again, this is a coordinated effort. I want to highlight the work of HRSA and CMS and AHRQ and CDC, Indian Health Service, SAMHSA from behavioral health, really all of us and many more, all of us working together on this. The plan will be released in 2023. Why is it going to be a little bit longer? I don't want to shock you. I know it was surprising to me, but there's a certain bureaucracy associated with the federal government. And so, you know, I was very surprised when I started 2 years ago. So things are taking their time to be reviewed and vetted. But I think that review process is important by all of those operating divisions and staff divisions, and of course the immediate office of the secretary, so that it is a team effort across HHS, that it is coordinated, that it is integrated, and it involves all that voices. The other thing that has taken some time is to hear from all of you, and to hear from the community and from patients. And so we've taken great pains to do that. So it's going to take a little bit longer, but it is going really well, and it'll be released in 2023.
Thank you. Thank you. Yes, it is a process. Here we are working on an HHS initial action plan to strengthen primary health care. How does this plan differ, or is it the same, compare to the NASEM report on primary care and its implementation plan?
Well, I really would like to thank the National Academy for Science, Engineering, and Medicine. I think they produced a wonderful report. And that NASEM report kind of provides some of the framework for our report. Ours might be even a little bit broader, than the initial NASEM report, looking at other components of primary health care, looking at the coordination of care, the integration of care. And again, it's going to have pieces and thoughts from across all of the divisions at HHS. So I think that it's going to be a great report, and the NASEM report's the framework, but we're going to try to go even beyond that. One of the things that we're trying to do is to launch a dashboard. And we're thankful to the Milbank Memorial Fund for that, and I think the dashboard will be really interesting as well.
Yeah, thank you. Okay, so you mentioned, Admiral Levine, about all the work that was done, not only with working across the federal government with our HHS partners, but reaching out to all of you and external stakeholders. How did you ensure public input into the initial action plan?
Well, you know, we had
initiative?
Countless stakeholder meetings and Zooms and efforts to do that. We have heard from families and patients. We've heard from professional societies and organizations. We've heard from the payers. We've heard from employers. We've heard from researchers, educators, foundations, institutes, and more. We've had listening sessions where we really just listened. I think it's so important for us to listen to what you all have to say and to really all those stakeholders have to say. We also had a request for information, an RFI. Everything has acronyms in the federal government. This spring and summer, and we had over 300 responses. So we have taken great pains to hear from everybody as we produce our report.
Yeah, thank you. All right. So the NASEM report, as I mentioned, included an implementation plan to better ensure that its recommendations get implemented. So how does the HHS, or what HHS efforts are already underway to implement the NASEM implementation plan?
Sure. So we absolutely have been working on that. In terms of payment reform, I don't know if you all are interested in terms of payment reform. Is that objective of interest to you? CMS continues to recognize the really importance of primary care and transformation in primary care, and they are certainly looking to broaden the footprint of primary care models. CMS CMI is advancing models. And I know that Dr. Doug Jacobs from CMS is going to be coming here, actually maybe the next presentation. I know Doug really well. So he was the head of healthcare innovation at the Department of Human Services when I was the Secretary of Health in Pennsylvania. And so he is absolutely great, and I'm sure he's going to give you a great presentation about what CMS is doing. I understand there were some concerns about the fee schedule, and there's congressional impacts upon that we can't just change, but I'll leave that for Doug. We're looking at advancing the Medicare shared savings model. And one of the things I want to highlight is in terms of workforce health and workplace health. And then I would like to highlight the report from our Surgeon General, who has made that an absolute priority. We know, I mean, the COVID-19 pandemic has affected everyone, but it has impacted providers, and particularly primary care providers, on the front lines of dealing with the COVID-19 pandemic. It has impacted you all, and I'll say all of us, so hard. It has been a real challenge for you and all your staff in primary care offices, whether they're in private practice or in group practice or part of shared practice and academic practice. It has impacted primary care providers at the urban, at the suburban, and rural areas. And so our Surgeon General is really, really interested in that. And I would highlight his report, and feel free, and we can help you with those contacts, to reach out to the Surgeon General with your stories and your staff stories, because that's one of the things he's really interested in, is to hear from you and to deal with these issues of wellness and burnout in our field. Our nation depends upon you all so much, and we have to deal with these issues of wellness and burnout.
Great. So there are lots of examples of how HHS is really moving forward with the types of recommended actions from the NASEM report. And you'll be hearing more about that, especially around the payment, from Doug Jacobs. So with that, let me ask Admiral Levine, do you have any closing remarks?
What I'd really like to do in my closing remarks is to thank you. And I know your patients thank you, and their families thank you, but I think it's important to hear from the Department of Health and Human Services. And I would like to thank you. I know our secretary, and really at the highest levels of the government, to thank you, to thank your staff for the unbelievable work that you have done over the last, in many years, but especially over the last 3 years of the COVID-19 pandemic. With your help, we have done hundreds of millions of vaccinations. We have prescribed millions of doses of medicine for COVID-19. We have worked on terms of prevention and treatment and testing and treatment for COVID-19. We're working with you to address issues of long COVID. There was a report put out today from the CDC about actually deaths from long COVID, which is very concerning. And so this is going to be one of the things that we're all going to have to deal with and to work on. Other challenges, though, over the last number of years, particularly mental health challenges. And I think that it is so important to recognize the work that you all do and your staff do in terms of mental health, whether that's pediatric mental health, whether that's adolescent mental health, dear to my heart, or a mental health for adults and seniors. But as pediatricians, family physicians, family medicine physicians, internal medicine physicians, physician's assistants, nurses, nurse practitioners, psychiatrists, psychologists, and many others, all working together on COVID-19, on mental health issues, on all the other acute and chronic illnesses that you see. What I would like to do is to thank you. In addition, I'd like to personally congratulate Dr. Carolyn Clancy, who I hear is receiving the Barbara Starfield Award. Congratulations, a very well-deserved award. Thank you so much. And we just would really like to, again, thank you for all of your work in the past, now, and in the future. Thank you.
Thank you, Admiral Levine. Okay, so now it's time to open up for audience questions and answers. And since I cannot see a thing,
nope.
out there. Someone's going to have to just start asking.
Yeah, raise your hands and we'll come running to you if you have a question. Don't be shy.
Mine's more of a comment, and I appreciate your spirit of collaboration. I work for the Department of Veterans Affairs, and we have an MOU with you guys to deploy Public Health Service commissioned officers, and it's made a huge difference in our hard and difficult to recruit areas. I think currently we have we just updated the MOU that went from 70 to, I think it's to either 200 or 240. I can't remember the number, but I just want to thank you and let you know how grateful we are. They've made a huge impact. We had them come on board before COVID, and they were instrumental in understanding how to deploy resources because of their training. They also have leadership training. So just thank you for that continued partnership and helping increase that cap. Thank you.
Thank you so much. I really appreciate our collaboration with the VA. I want to highlight a couple points. One is I want to highlight the fantastic work that the Veterans Administration has done in terms of care for patients in COVID-19 and all of the other challenges that our veterans face. I also want to highlight the work of the VA in long COVID. So, again, long COVID, our office leads in terms of long COVID, in terms of supports and services, and working with the NIH and the CDC in terms of research. But I want to highlight the work that the VA has done in terms of both supports and services and centers of excellence and hub and spokes models for long COVID, who really are leading us in terms of those models. And I also want to highlight the research being done at the VA on long COVID, which is really outstanding. With your integrated medical system and your integrated medical record, really the biggest health system in the country, you have been able to mine that data for invaluable research on long COVID. So thank you so much. I also want to highlight the statement you made, I'm going to take a second, sorry, about the ASH's prerogative, about the Public Health Service Commission Corps. So we have actually almost 6,000 Commission Corps officers who are physicians, who are nurses, nurse practitioners, physician's assistants, dentists, pharmacists, veterinarians, and more, who work actually across the country to help protect our nation's public health. They also provide medical care at the Indian Health Service and at the Federal Bureau of Prisons. We have a new system for a ready reserve. So if anyone is at all interested, you can actually be in your practice of primary care, but then actually take the uniform when our service and our country needs you. It's a brand new program for a ready reserve, kind of like the National Guard. So if anyone's interested, please let us know.
Right. Other questions?
Yeah, Mike Tuggy from rural Washington. I'm a family physician in a small community, and the workforce issues we're facing are really tremendous within our system. And what do you see the role of HHS in stimulating either funding for training, especially for medical assistants and nurses, and clearly for primary care physicians and APPs that we need in our networks?
Absolutely. Well, I think that HHS has a very important role in terms of training primary care physicians, but other providers as well, whether it's nurse practitioners, physician's assistants, nurses, and more. I think one of our divisions that has an absolutely critical role in this is HRSA. And HRSA plays a very important role. And I want to highlight the fantastic work that HRSA does in terms of stimulating and providing resources and funding and loan repayment, et cetera, for primary care practitioners. I want to also highlight their federally qualified health centers, community health centers, which do a fantastic job for primary care and more. So we are looking through our primary care initiative and others in order to how to provide funding and resources and to be as a catalyst for more primary care providers, and I think it's critically important. We're also looking at the workforce for our behavioral health workers, so that we have more behavioral health workers across the span of, from therapists, master's level therapists, peer counselors, in terms of nurses, nurse practitioners, psychiatrists, and more, because we need that in order to work with you in terms of the mental health needs of our country. There's one back there.
Questions?
Hello, I'm Dr. Nkemo Keke. I'm founder and CEO of Medical Links, a population health management firm. We help primary care practices, including those in the some of the FQHCs. So first of all, I want to say thank you for saying thank you. Sometimes you go the extra mile because you feel appreciated. So to hear that from the highest level of the government, that we are appreciated. You mentioned something about working with Milbank to build or launch a dashboard. So excited to know that we would have a special war room that would be monitoring the primary healthcare status in the country. Question here is, what is the effort made to make sure that we are going to build that dashboard with all the data that matters, knowing that we have data from the payer side, provider side, that we still have, problems with, interoperability and connecting the dots? What are your thoughts around how you intend to solve this problem with this launch of this dashboard?
Thank you so much. I'm actually going to turn to the expert, Dr. Judy Steinberg, to answer that question.
Yes, thank you for that question. It's really important. If we're going to take some action, we need to know what was the impact of that action. And Admiral Levine mentioned the fine work that's being spearheaded by the Milbank Memorial Fund to develop a primary care scorecard. This was recommended in the NASM primary care report. And they, my understanding, is soon to be releasing their baseline data and report. And this is a starting point for measuring the health of primary care in the nation. So let's turn now to the HHS initiative to strengthen primary health care. As Admiral Levine noted, we are taking a little broader approach, thinking about the whole of primary health care, where primary care is an integrated clinical services, is an important component. But we're thinking about the whole with integration with public health and social services, et cetera. So it has a little broader scope. And therefore, we need an HHS initiative, a dashboard that measures the health from that perspective. So we are in the process, to your point about how do we ensure about getting the right measures in that dashboard, we're in the process of identifying measures that are, for which data is already being collected, and then identifying the gaps. What measures might we also need to put into place to make this a robust dashboard? So thank you.
Hi, I'm Katie Capps. I'm the co-founder and executive director of the Get the Medications Right Institute, and I want to thank you for the ongoing listening sessions that you've had throughout the country. I think that is so important as you look at reinventing primary care. We had the pleasure of participating in one of those as you looked at the role of the clinical pharmacist in the patient care process. I'd be interested in hearing from you, in what way do you feel that the clinical pharmacist can be integrated into a patient care process, not the historical dispensing role of the pharmacist, but in order to get the medications right, given that medications are such an important treatment for many primary care patients?
Thank you for that question. I really want to highlight the importance of pharmacists. You all have played such a critically important role during the COVID-19 pandemic. There are a lot of lessons that we've learned during the pandemic, and one of them is I think that all of the healthcare team needs to work at the top of their license, and I think that that includes pharmacists at many different levels. And so I think both in outpatient care and in inpatient care, it's really important that pharmacists are right there at the table, and that primary care physicians are working with pharmacists, perhaps at their institution or at their practice or in their community, and so that there's a lot of that collaboration as well. I've also been very impressed about pharmacists that are working in behavioral health and psychiatric pharmacists or psychological pharmacists that are working, which I think can be a real help to primary care physicians as we deal with the really crisis in mental health that we're seeing. We talked about the behavioral health workforce, which I think is critical, but be honest with you, in the near future, we're never going to have enough psychiatrists and child and adolescent psychiatrists to be able to see all those patients. So I think that a lot of that work is going to come to primary care physicians, whether they're pediatricians, family physicians, family medicine physicians, internal medicine physicians, but also nurse practitioners, physicians' assistants. And I think working with pharmacists will be a real help.
My name is Alan Gorel. I'm a teacher of primary care, future primary care doctors and nurse practitioners. And when my students who wanted to go into primary care would come to me for a recommendation after having had good clinical experiences, they didn't make eye contact, because they found at the time of deciding where they were going to go for residency training that the primary care mission was attractive but not doable. And their diagnosis was that the payment system, which drives daily patient care, was broken. And I'm heartened by the emphasis and the comprehensive approach you're taking, but my question is, where is payment reform in the list of priorities? Because I think that is the rate-limiting step to our getting to team-based care, personalized care, and the resources necessary to deliver the care that is necessary. And it's now being limited by the payment system.
Thank you for that question. I agree. There is an enormous challenge in terms of the payment system. And I think that is limiting the expansion of primary care, primary health care. So, it is a very important aspect of our plan in terms of reinventing and reimagining primary health care. I know that CMS is working on that, and others. I think part of it is in terms of loan repayment and those type of things, but the reimbursement is really important. And I would speak to Doug. I'm sure Doug will be talking about that, and it is something that is very important to how this system will work. Is there anything else you'd like to add?
Yeah, so thank you for that, and nice to see you, Alan. Payment impacts all the other goals. We get that. And so there's action that needs to be taken. And in terms of the new generation of providers choosing primary care, it is about the under-resourcing and the lack of staff to be able to, and the lack of infrastructure, the EHR is another piece of this, to be able to do what they were trained to do, and what they know is important to meet the needs of their patients. So we get that and see that payment is really the first step.
Thank you.